MACE Medication Aide Certification Examination MACE. Question 1. When a resident is taking an expectorant, it is important for them to also increase blank. Here are the options. Option A, fluid intake. Option B, food intake. Option C, fiber intake. Option D, activity. The correct answer is option A, fluid intake. Question 2. Which of the following H2 receptor blockers can interfere with the effect of many classifications of medications? Here are the options. Option A, cimetidine. Option B, famotidine. Option C, nizatidine. Option D, ranitidine. The correct answer is option A, cimetidine. Question 3. Which of the following medications is prescribed for hypothyroidism? Here are the options. Option A, Synthroid. Option B, Inderal. Option C, metformin. Option D, Cymit. The correct answer is option A, Synthroid. Question 4. In which of the following ways do bronchodilators work? Here are the options. Option A, open airways by constricting smooth muscles in the bronchial tree. Option B, decreases rhinorrhea. Option C, decreases cough and clears airway. Option D, open airways by dilating smooth muscles in the bronchial tree. The correct answer is option D, open airways by dilating smooth muscles in the bronchial tree. Question 5. To which class of medication does verapamil belong? Here are the options. Option A, calcium channel blocker. Option B, beta blocker. Option C, ACE inhibitor. Option D, ARB. The correct answer is option A, calcium channel blocker. Question 6. The medication aide's responsibilities include all of the following except blank. Here are the options. Option A, carries out delegated nursing tasks. Option B, performs direct care to residents without supervision. Option C, recognizes and performs tasks according to level of education and training. Option D, accepts responsibility and accountability for own performance according to state laws and regulations regarding medication aides. The correct answer is option B, performs direct care to residents without supervision. Question 7. Furosemide is a blank for a commonly prescribed diuretic. Here are the options. Option A, trade name. Option B, chemical name. Option C, generic name. Option D, popular name. The correct answer is option C, generic name. Question 8. It is necessary to wash hands in all of the following situations except blank. Here are the options. Option A, when the hands become visibly soiled. Option B, before administering medications. Option C, after removing gloves. Option D, when arriving at work. The correct answer is option D, when arriving at work. Question 9. Gloves should be worn when blank. Here are the options. Option A, giving oral medication. Option B, coming into contact with body fluids. Option C, entering a resident's room. Option D, Collecting the trash. The correct answer is option B. Coming into contact with body fluids. Question 10. After the resident has inhaled his or her dose of parenteral, the next step is to have him / her blank. Here are the options. Option A. Rinse out his or her mouth with water. Option B. Hold in the medication for as long as possible. Option C. Breath out as hard and fast as he / she can. Option D. None of the above. The correct answer is option B. Hold in the medication for as long as possible. Question 11. Which of the following medications belongs in the classification of an antibiotic? Here are the options. Option A. 5-FU. Option B. Chlorpromazine. Option C. Valium. Option D. Bactrim DS. The correct answer is option D. Bactrim DS. Question 12. Requiring more of a medication to feel good or to be able to carry out daily activities is called blank. Here are the options. Option A. Tolerance. Option B. Dependence. Option C. Cumulative effect. Option D. A drug interaction. The correct answer is option B. Dependence. Question 13. What is the best source for the medication A when checking for drug information? Here are the options. Option A. Newspaper. Option B. A fellow medication aide. Option C. A pharmacist. Option D. The patient. The correct answer is option C. A pharmacist. Question 14. Which is the fastest absorption of medication? Here are the options. Option A. Through the skin. Option B. Through the muscle. Option C. Through the veins. Option D. Through the stomach. The correct answer is option C. Through the veins. Question 15. Some medications to treat cancer are classified as antineoplastic. Which of the following medications is an antineoplastic medication? Here are the options. Option A. Prilosec. Option B. 5-FU. Option C. Ampicillin. Option D. Cardizem. The correct answer is option B. 5-FU. Question 16. Which of the following is an appropriate action when administering eardrops? Here are the options. Option A. Keep the medication in the refrigerator until just before administering it. Option B. Have the person lie on his or her side for 15 to 20 minutes. Option C. Place an ear wick in the affected ear for greater absorption. Option D. Administer the medication only to the ear it is prescribed. The correct answer is option D. Administer the medication only to the ear it is prescribed. Question 17. For which of the following patients would you withhold oral medications? Here are the options. Option A. A patient who has had a stroke and needs to have liquids thickened. Option B. A patient who is unconscious. Option C. A patient who is blind. Option D. A patient who is awake and alert and has no deficits. The correct answer is option B. A patient who is unconscious. Question 18. Which of the following medications would be prescribed for anxiety? Here are the options. Option A, Inderal. Option B, Lasix. Option C, Valium. Option D, Celebrex. The correct answer is option C, Valium. Question 19. Which of the following medications is used as an antihypertensive medications? Here are the options. Option A, ACE inhibitor. Option B, NSAIDs. Option C, Xanax. Option D, calcium. The correct answer is option A, ACE inhibitor. Question 20. What should the medication aid wear when administering transdermal nitroglycerin patches? Here are the options. Option A, eye protection. Option B, gloves. Option C, gown and gloves. Option D, eye protection gown and gloves. The correct answer is option B, gloves. Question 21. Which of the following are side effects of nitroglycerin? Here are the options. Option A, headache. Option B, vertigo. Option C, vomiting. Option D, anorexia. The correct answer is option A, headache. Question 22. Which of the following is an expectorant? Here are the options. Option A, Spiriva. Option B, Benadryl. Option C, Loratadine. Option D, Guaifenesin. The correct answer is option D, Guaifenesin. Question 23. A resident is ordered ferrous sulfate 325 mg 3 times a day for anemia. Which of the following things about administering the medication is it important for the medication aid to know? Here are the options. Option A, give with milk. Option B, administer on an empty stomach. Option C, give with orange juice. Option D, allow the resident to take with other medications. The correct answer is option C, give with orange juice. Question 24. Which of the following include common side effects of nitrates? Here are the options. Option A, headache, flushing, postural hypotension. Option B, blurred vision and dry mouth. Option C, weight gain or worsening CHF. Option D, dizziness. The correct answer is option A, headache, flushing, postural hypotension. Question 25. HMG-CoA inhibitors belong to a class of medications known as statins. Statins are known for at least one serious adverse effect on blank major system. Here are the options. Option A, cardiovascular. Option B, respiratory. Option C, musculoskeletal. Option D, gastrointestinal. The correct answer is option C, musculoskeletal. Question 26. Before giving metoprolol, the medication aid should know if the resident has a history of blank. Here are the options. Option A, headaches. Option B, bronchospasms. Option C, angina. Option D, constipation. The correct answer is option B, bronchospasms. Question 27. A resident has been ordered Synthroid and wants to know what it is prescribed for. What is the correct answer? Here are the options. Option A, hypothyroidism. Option B, hypertension. Option C, hyperthyroidism. Option D, hypotension. The correct answer is option A, hypothyroidism. Question 28. Which of the following is a serious adverse effect of Synthroid? Here are the options. Option A, tachycardia. Option B, malignant hyperthermia. Option C, fatigue. Option D, hypotension. The correct answer is option A, tachycardia. Question 29. A resident is taking metformin. The medication aide knows this medication is taken for blank. Here are the options. Option A, diabetes mellitus type 1. Option B, diabetes mellitus type 2. Option C, diabetes insipidus. Option D, hypothyroidism. The correct answer is option B, diabetes mellitus type 2. Question 30. If a resident is to have a test that utilizes dye, which medication must be withheld for 24 hours before and 48 hours after the test? Here are the options. Option A, Starlit. Option B, Precose. Option C, Actose. Option D, Glucophage. The correct answer is option D, glucophage. Question 31. The medication aide explains to a resident's family member that the most effective treatment for acne is blank. Here are the options. Option A, soap and water. Option B, cryotherapy. Option C, dietary restrictions. Option D, astringent medication. The correct answer is option D, astringent medication. Question 32. Which of the following medications is used for fast relief from increased wheezing and shortness of breath for a resident who suffers from asthma? Here are the options. Option A, aminophylline. Option B, Asmacort. Option C, Provental. Option D, Spiriva. The correct answer is option C, Provental. Question 33. Which of the following is the generic name for Zithromax? Here are the options. Option A, clarithromycin. Option B, azithromycin. Option C, erythromycin. Option D, oxamycin. The correct answer is option B, azithromycin. Question 34. What is the most common side effect of acyclovir? Here are the options. Option A, hypertension. Option B, tachycardia. Option C, bradycardia. Option D, headache. The correct answer is option A, hypertension. Question 35. When can an MACE refuse an assignment? Here are the options. Option A, when it is almost time for his or her shift to end. Option B, when he or she is too busy. Option C, when the task is unclear. Option D, when the nurse is not busy. The correct answer is option C, when the task is unclear. Question 36. Every new resident of an extended care facility should be provided a copy of blank publication. Here are the options. Option A. The rights of the state agency. Option B. The rules and regulations for residents. Option C. The patient's Bill of Rights. Option D. The resident's Bill of Rights. The correct answer is option D. The resident's Bill of Rights. Question 37. The MACE is responsible for knowing the medical information of blank. Here are the options. Option A. All residents at the MACE's place of employment. Option B. Each of the residents he/she is assigned to. Option C. All residents on his or her unit or floor. Option D. All residents assigned to his or her supervising nurse. The correct answer is option B. Each of the residents he/she is assigned to. Question 38. The MACE is administering guaifenesin to a resident as part of the resident's treatment for the flu. Which of the following responses would the MACE see that would demonstrate the effectiveness of the treatment? Here are the options. Option A. The resident becomes febrile. Option B. The resident sleeps through the night. Option C. The resident's cough is looser and productive. Option D. The resident experiences a decrease in coughing. The correct answer is option C. The resident's cough is looser and productive. Question 39. The MACE knows the correct method for preparing to administer a meter-dose inhaled respiratory medication is blank. Here are the options. Option A. Shake the medication container. Option B. Do not shake but roll the medication container in the palms of the hands until well mixed. Option C. Set the medication out at room temperature until it reaches body temperature. Option D. Do not shake or roll the medication container before administering. The correct answer is option A. Shake the medication container. Question 40. Which statement is a benefit of an oral decongestant? Here are the options. Option A. Less chance of rebound congestion. Option B. Higher potency. Option C. Longer acting. Option D. Tastes better. The correct answer is option A. Less chance of rebound congestion. Question 41. Which of the following medications is given for a bacterial infection? Here are the options. Option A. Prescar. Option B. Flagyl. Option C. Cardizem. Option D. Tetracycline. The correct answer is option D. Tetracycline. Question 42. The MACE knows that it is not appropriate to blank when taking an antibiotic. Here are the options. Option A. Stop the medication when symptoms clear. Option B. Take the medication until the medication is gone. Option C. Drink plenty of fluids. Option D. Follow standard precautions. The correct answer is option A. Stop the medication when symptoms clear. Question 43. Which of the following foods should avoid a resident who is taking a chlorcon potassium replacement? Here are the options. Option A. Apples. Option B. Grapefruit. Option C. Tomatoes. Option D. Bananas. The correct answer is option D. Bananas. Question 44. Many older individuals have used baking soda as a home remedy for indigestion. Baking soda should not be taken if the resident has blank. Here are the options. Option A. Congestive heart failure. Option B. Renal disease. Option C. Osteoporosis. Option D. Hypertension. The correct answer is option C. Osteoporosis. Question 45. Residents who are taking PPI should only take them for the following durations. Here are the options. Option A. Until symptoms subside. Option B. For as long as they are affordable. Option C. After they have eaten a bland diet for 2 weeks. Option D. Until discontinued by their healthcare provider. The correct answer is option D. Until discontinued by their healthcare provider. Question 46. When should Carafate be administered? Here are the options. Option A. At least 1 hour before meals on an empty stomach. Option B. At least 1 hour after meals on a full stomach. Option C. With meals when food is in the stomach. Option D. With fluids just before the meal. The correct answer is option A. At least 1 hour before meals on an empty stomach. Question 47. What is the maximum dose of Tylenol in 24 hours? Here are the options. Option A. 3 grams. Option B. 6 grams. Option C. 1 gram. Option D. 2 grams. The correct answer is option A. 3 grams. Question 48. Tramadol is a non-narcotic centrally acting analgesic. Which of the following is the most serious adverse effect listed that may occur when taken? Here are the options. Option A. Excessive hunger. Option B. GI bleeding. Option C. Seizures. Option D. Nervousness. The correct answer is option C. Seizures. Question 49. Which of following forms of medication can be cut in half? Here are the options. Option A. Non-scored tablet. Option B. Caplet. Option C. Capsule. Option D. Scored tablet. The correct answer is option D. Scored tablet. Question 50. Fall precaution is important for residents taking anticonvulsant medications. Which of the medications is an anticonvulsant? Here are the options. Option A. Sudafed. Option B. Neurontin. Option C. Topical XL. Option D. Naloxone. The correct answer is option B. Neurontin. Question 51. What is the most common bacteria that causes most UTIs? Here are the options. Option A. Staphylococcus aureus. Option B. Pseudomonas aeruginosa. Option C. Escherichia coli. Option D. Enterococcus faecalis. The correct answer is option C. Escherichia coli. Question 52. Where should you hold the eyedropper when instilling eye drops? Here are the options. Option A. Close enough to touch the cornea. Option B. 0.5 to 0.75 inches from the lid surface. Option C. 3 to 4 inches away from conjunctiva. Option D, 1 inch to 1.5 inches from the lid surface. The correct answer is option B, 0.5 to 0.75 inches from the lid surface. Question 53. When administering several medications at the same time, they must be given in a particular order. Which of the following is the correct order? Here are the options. Option A, tablets, liquids, syrups, and lozenges. Option B, liquids, syrups, tablets, and lozenges. Option C, lozenges, tablets, liquids, and syrups. Option D, syrups, liquids, tablets, and lozenges. The correct answer is option A, tablets, liquids, syrups, and lozenges. Question 54. A medical emergency can also arise due to a sudden life-threatening drug reaction, known as anaphylaxis. Which of the following is a sign of anaphylaxis? Here are the options. Option A, dry hives. Option B, shortness of breath. Option C, nausea. Option D, headache. The correct answer is option B, shortness of breath. Question 55. 1 pint equals blank milliliters. Here are the options. Option A, 100 ml. Option B, 200 ml. Option C, 500 ml. Option D, 300 ml. The correct answer is option C, 500 ml. Question 56. Which of the following is an example of a steroid medication? Here are the options. Option A, clindamycin. Option B, metoprolol. Option C, hydrocodone. Option D, prednisone. The correct answer is option D, prednisone. Question 57. A pulse rate that stays below 60 is considered an indication of blank. Here are the options. Option A, hypertension. Option B, bradycardia. Option C, hypotension. Option D, tachycardia. The correct answer is option B, bradycardia. Question 58. A provider may exchange a brand name drug for a less expensive form of the drug known as blank. Here are the options. Option A, trade name. Option B, chemical name. Option C, generic name. Option D, popular name. The correct answer is option C, generic name. Question 59. Which medication is administered for anxiety? Here are the options. Option A, diazepam. Option B, antivert. Option C, morphine. Option D, nitroglycerin. The correct answer is option A, diazepam. Question 60. Which medication is an anticoagulant? Here are the options. Option A, vitamin K. Option B, warfarin. Option C, ferrous sulfate. Option D, melatonin. The correct answer is option B, warfarin. Question 61. What is the generic name for Motrin? Here are the options. Option A, acetylsalicylic acid. Option B, Ecotrin. Option C, ibuprofen. Option D, naproxen. The correct answer is option C, ibuprofen. Question 62. Which is the best way for an MACE to avoid spreading infection? Here are the options. Option A, wash hands. Option B, wear gloves while performing all procedures. Option C, apply lotion to hands frequently. Option D, wear a gown when entering residence rooms. The correct answer is option A, wash hands. Question 63. The Resident's Bill of Rights includes all of the following except for blank. Here are the options. Option A, access to privacy. Option B, freedom from abuse. Option C, grievance without retribution. Option D, ability of the facility to discharge the resident without reason. The correct answer is option D, ability of the facility to discharge the resident without reason. Question 64. A resident has received a change of order from PO Lasix to Roman 4 push Lasix. The medication aide realizes that according to the job description for medication administration aids blank. Here are the options. Option A, Roman 4 medication can be administered by the MACE as long as a registered nurse is present. Option B, the medication aide cannot administer Roman 4 medication under any conditions. Option C, the medication aide can administer the Lasix after the initial dose is given by the RN. Option D, the medication aide can administer the Lasix so long as the medication does not need to be titrated to effect. The correct answer is option B. The medication aide cannot administer Roman 4 medication under any conditions. Question 65. When the RN delegates duties that are outside of the medication aide's job description blank. Here are the options. Option A, the medication aide is accountable for the RN's actions. Option B, the RN is accountable for the medication aide's actions. Option C, the RN is accountable for everyone's actions. Option D, the RN and the medication aide are responsible for the delegated actions. The correct answer is option D. The RN and the medication aide are responsible for the delegated actions. Question 66. Failure to report a performance error could result in problems with the facility or with an accreditation agency. Which answer is correct? Here are the options. Option A, true. Option B, false. Option C, only if the resident is injured. Option D, only if the physician requests a report. The correct answer is option A, true. Question 67. What is the next step after administering a medication to a resident? Here are the options. Option A, record the administration on the MAR. Option B, give the resident a bath. Option C, communicate to the nurse that the resident's medication has been administered. Option D, check the resident's identification. The correct answer is option A, record the administration on the MAR. Question 68. Which of the following conditions puts the resident at risk when receiving intravenous? Here are the options. Option A, heart attack. Option B, hypertension. Option C, COMT. Option D, irregular heartbeat. The correct answer is option C, COP. Question 69. What is the most common side effect of alpha-1 adrenergic blockers? Here are the options. Option A, lightheadedness and syncope upon standing. Option B, inability to urinate. Option C, dry mouth. Option D, priapism. The correct answer is option A, lightheadedness and syncope upon standing. Question 70. Which of the following is a side effect of metformin? Here are the options. Option A, weight gain. Option B, diarrhea. Option C, dry skin. Option D, elevated blood sugar. The correct answer is option B, diarrhea. Question 71. A resident is receiving an antithyroid drug. Which of the following elements found in food should the resident avoid? Here are the options. Option A, sodium. Option B, potassium. Option C, iodine. Option D, magnesium. The correct answer is option C, iodine. Question 72. A resident who is taking antibiotics experiences a rash. What is this resident experiencing? Here are the options. Option A, adverse effect. Option B, anaphylactic. Option C, side effect. Option D, allergic reaction. The correct answer is option D, allergic reaction. Question 73. Potassium liquid should never be given without first being blank. Here are the options. Option A, diluted. Option B, iced. Option C, tested. Option D, sweetened. The correct answer is option A, diluted. Question 74. Which of the following medications belong in the classification of an antiparkinson medication? Here are the options. Option A, synthroid. Option B, inderal. Option C, metformin. Option D, Cymit. The correct answer is option D, Cymit. Question 75. Patients who have reflux disease should avoid all of the following foods except for blank. Here are the options. Option A, peanuts. Option B, spicy foods. Option C, tomatoes, citrus, and onions. Option D, high-fat foods. The correct answer is option A, peanuts. Question 76. Which of the following medications could be used for hypertension? Here are the options. Option A, inderal. Option B, Cymit. Option C, synthroid. Option D, glipizide. The correct answer is option A, inderal. Question 77. Which of the following is not a diuretic? Here are the options. Option A, spironolactone. Option B, hydrochlorothiazide. Option C, triametoran. Option D, hydrocodone. The correct answer is option D, hydrocodone. Question 78. What is the minimum number of patient identifiers that should be used to make sure the right patient is getting the medication? Here are the options. Option A, 3. Option B, 1. Option C, 4. Option D, 2. The correct answer is option D. 2. Question 79. Which of the following medications is classified as an anti-hyperglycemic? Here are the options. Option A, Inderal. Option B, Cymit. Option C, Synthroid. Option D, Glipizide. The correct answer is option D, Glipizide. Question 80. Considering the list of medications below, which one would be prescribed for psychosis? Here are the options. Option A, 5-FU. Option B, chlorpromazine. Option C, Valium. Option D, Bactrim DS. The correct answer is option B, chlorpromazine. Question 81. When approaching a combative patient, all of the following are correct except blank. Here are the options. Option A, stand over a combative client to show you are able to control him/her if necessary. Option B, approach in a calm, reassuring manner. Option C, speak slowly and clearly. Option D, ask for assistance as needed to maintain a safe distance as you approach the client. The correct answer is option A, stand over a combative client to show you are able to control him/her if necessary. Question 82. What is the single most important step for the medication aide to perform to prevent the spread of infection while administering medications? Here are the options. Option A, wash his or her hands frequently. Option B, wear protective eyewear. Option C, wear gloves. Option D, wash patient hands frequently. The correct answer is option A, wash his or her hands frequently. Question 83. If you have worn gloves while administering medications, it is not necessary for you to wash your hands. Which answer is correct? Here are the options. Option A, true. Option B, false. Option C, only after oral medications. Option D, only after topical medications. The correct answer is option B, false. Question 84. All of the following are important actions for the medication aide to prevent a lawsuit except blank. Here are the options. Option A, perform your duties according to your position description. Option B, flirt with family members and the patient. Option C, communicate effectively and efficiently. Option D, maintaining a positive attitude. The correct answer is option B, flirt with family members and the patient. Question 85. Which of following is one of the 6 rights of medication administration? Here are the options. Option A, right to refuse care. Option B, right dose. Option C, right to choose. Option D, right to request change in medication. The correct answer is option B, right dose. Question 86. Which of the following is the definition of ethics? Here are the options. Option A, the study of euthanasia. Option B, the science of doing good for others. Option C, a set of principles that professionals can use to help them make decisions. Option D, speaking the truth consistently and dependably. The correct answer is option C, a set of principles that professionals can use to help them make decisions. Question 87. When administering ear drops, you do all of the following except for what? Here are the options. Option A. Keep the medication in the refrigerator until just before administering it. Option B. Massage the ear after administering the medication. Option C. Remove any cerumen with a clean washcloth that may be blocking the medication installation. Option D. Administer the medication to the prescribed ear only. The correct answer is option A. Keep the medication in the refrigerator until just before administering it. Question 88. All of the following are side effects of antineoplastic antibiotics except blank. Here are the options. Option A. Bone marrow depression. Option B. Alopecia. Option C. Hypertension. Option D. Skin irritation. The correct answer is option B. Alopecia. Question 89. You are not sure about a drug order and whether you should give the drug or not. What do you do? Here are the options. Option A. Call the pharmacist. Option B. Ask the charge nurse. Option C. Ignore the drug order. Option D. Ask the patient what to do. The correct answer is option B. Ask the charge nurse. Question 90. Which agency can deny, revoke, or suspend a Med-Aide certification? Here are the options. Option A. The Oregon Health Authority OHA. Option B. The Oregon State Board of Nursing OSBN. Option C. The National Council of State Boards of Nursing. Option D. The facility where the CMA is employed. The correct answer is option B. The Oregon State Board of Nursing OSBN. Question 91. A nurse asks you to find out from the patient what their pain level is. What should you do? Here are the options. Option A. Talk with the patient and ask them what their pain scale number is. Option B. Refuse to do it and tell the nurse she needs to do this as it is their job. Option C. Ask the nursing assistant assigned to the patient to get this. Option D. Report the nurse to the administrator or DNS of the facility. The correct answer is option A. Talk with the patient and ask them what their pain scale number is. Question 92. Violating or failing to comply with the Controlled Substance Act is illegal. What may be the result? Here are the options. Option A. Being arrested and paying a fine. Option B. Being arrested and put in prison. Option C. Being arrested, paying a fine, and jail. Option D. Being investigated only by the Board of Nursing. The correct answer is option C. Being arrested, paying a fine, and jail. Question 93. A drug interaction occurs when blank. Here are the options. Option A. A person cannot control how the drug is absorbed. Option B. A drug's action is altered by another drug taken at the same time. Option C. A person begins to need a higher dose to achieve the same effect. Option D. Withdrawal symptoms occur if the drug is not taken. The correct answer is option B. A drug's action is altered by another drug taken at the same time. Question 94. When a drug has an undesired effect that is not part of the goal of drug therapy, it is called a /an. Here are the options. Option A. Side effect. Option B. Contraindication. Option C. Synergistic response. Option D. Idiosyncratic response. The correct answer is option A. Side effect. Question 95. Shows the correct number that Roman numeral Roman 4 represents. Here are the options. Option A, 3. Option B, 4. Option C, 5. Option D, 6. The correct answer is option B, 4. Question 96. Mrs. Smith has a dentist appointment tomorrow. Looking at the MAR, you see that she is to get amoxicillin 500 mg the day before all her dental appointments. This is an example of what type of medication order. Here are the options. Option A, PRN order. Option B, single order. Option C, standing order. Option D, stat order. The correct answer is option B, single order. Question 97. A resident is being admitted to the facility later today. There are orders on the MAR for some PRN meds. These are not their regular medication orders. What kind of drug order is this? Here are the options. Option A, stat order. Option B, PRN order. Option C, single order. Option D, standing order. The correct answer is option D, standing order. Question 98. How many teaspoons are in 1 tablespoon? Here are the options. Option A, 1. Option B, 2. Option C, 3. Option D, 4. The correct answer is option C, 3. Question 99. The medication order is not complete. What should you do? Here are the options. Option A, give the drug and call the pharmacy to get a new order. Option B, give the drug and ask the nurse to call the doctor to get a new order. Option C, hold the drug and call the pharmacy to get a new order. Option D, hold the drug and ask the nurse to check the order in the chart. The correct answer is option D. Hold the drug and ask the nurse to check the order in the chart. Question 100. Before giving any drug, you compare the label on the drug package against the A. Here are the options. Option A, MAR. Option B, Cardex. Option C, nurse's notes. Option D, pharmacy notes. The correct answer is option A, MAR. Question 101. An antipruritic medication would be used to treat which condition? Here are the options. Option A, athlete's foot. Option B, an itchy rash. Option C, sunburn. Option D, scabies. The correct answer is option B, an itchy rash. Question 102. A sublingual drug is given blank. Here are the options. Option A, in the eye. Option B, under the skin. Option C, under the tongue. Option D, between the cheek and gums. The correct answer is option C, under the tongue. Question 103. Your resident has just had cataract surgery and has orders for eye drops. What do you do? Here are the options. Option A, give them the eye drops as ordered. Option B, let the nurse know you cannot give these meds. Option C, have the patient give their eye drops themselves. Option D, chart that the meds were not given. The correct answer is option B, Let the nurse know you cannot give these meds. Question 104. The CMA in Oregon may appropriately do which action? Here are the options. Option A. Administer parenteral medications. Option B. Reorder medications from the pharmacy. Option C. Gather the patient's medication history. Option D. Disposing of narcotics. The correct answer is option B. Reorder medications from the pharmacy. Question 105. The CMA is responsible for administering. Here are the options. Option A. Only the drugs learned in school. Option B. Meds under the supervision of a nurse. Option C. Medications by all routes. Option D. All medications ordered. The correct answer is option B. Meds under the supervision of a nurse. Question 106. The provider orders 5 mg of medication. The med label read 10 mg and 10 ml. How much med do you give? Here are the options. Option A. 10 ml. Option B. 2.5 ml. Option C. 50 ml. Option D. 5 ml. The correct answer is option B. 2.5 ml. Question 107. When administering ear medication to an adult patient, you would gently. Here are the options. Option A. Pull the ear down and back. Option B. Push the ear forward. Option C. Just place the drop into the ear. Option D. Pull the ear up and back. The correct answer is option D. Pull the ear up and back. Question 108. Ophthalmic drugs are given by what route? Here are the options. Option A. In the ear. Option B. In the eye. Option C. In the nose. Option D. On the skin. The correct answer is option B. In the eye. Question 109. The term drug standards refers to blank. Here are the options. Option A. The official non-proprietary name of the drug. Option B. The Controlled Substances Act of 1970. Option C. The law that requires labels and warnings against unsafe use. Option D. The law where drugs must be of uniform strength, quality, and purity. The correct answer is option D. The law where drugs must be of uniform strength, quality, and purity. Question 110. The patient has a medical condition where the medication, treatment, or surgery is not advised. What is this called? Here are the options. Option A. An adverse reaction. Option B. A precaution. Option C. A contraindication. Option D. Pharmacokinetics. The correct answer is option C. A contraindication. Question 111. C.diff, a superinfection, can occur under what circumstances? Here are the options. Option A. The person takes an antiviral for their shingles and then starts to take an antifungal for athlete's foot. Option B. The person has a weakened immune system from their autoimmune diagnosis. Option C. The person has a severe reaction to the antibiotic causing an anaphylactic response. Option D. The person is taking more than one antibiotic or is on a broad-spectrum antibiotic. The correct answer is option D. The person is taking more than one antibiotic or is on a broad-spectrum antibiotic. Question 112. Your resident is allergic to penicillin. They now have an infection that requires penicillin treatment. Which antibiotic would you expect the doctor to prescribe? Here are the options. Option A, tetracycline. Option B, sulfonamide. Option C, penicillin. Option D, cephalosporin. The correct answer is option D, cephalosporin. Question 113. You have been listed on the registry as a CMA for 7 months. Your birthday is coming. Now you need to renew your CMA license. How many CU hours do you need to renew? Here are the options. Option A, 0 hours. Option B, 1 hour. Option C, 2 hours. Option D, 3 hours. The correct answer is option C, 2 hours. Question 114. You have taken a position at an adult care home with 5 residents. The owner is not a nurse, but home health and hospice nurses visit weekly. According to Oregon State Board of Nursing regulations, what should you know about those hours? Here are the options. Option A. The hours count towards CNA and CMA renewal because a nurse is in the house during the week. Option B. The hours count towards CNA and CMA renewal because you are providing nursing assistant and medication aid tasks. Option C. The hours will not count because there is no nurse on staff, so volunteering with hospice will provide the needed hours. Option D. The hours will not count toward renewal, so you should get qualifying hours in a long-term/skilled facility. The correct answer is option D. The hours will not count toward renewal, so you should get qualifying hours in a long-term/skilled facility. Question 115. What is the minimum number of hours on the job that you need to renew your certificate every 2 years? Here are the options. Option A, 40 hours. Option B, 80 hours. Option C, 1,000 hours. Option D, 400 hours. The correct answer is option D, 400 hours. Question 116. Under Conduct on Becoming of a Certified Medication Aide, which action is not allowed? Here are the options. Option A, taking someone else's medications. Option B, reporting a medication error. Option C, refusing an unclear assignment. Option D, asking the nurse for clarification. The correct answer is option A, taking someone else's medications. Question 117. What is something you should do before giving barbiturates? Here are the options. Option A, check heart rate. Option B, check pulse. Option C, check BP. Option D, check respiratory rate. The correct answer is option D, check respiratory rate. Question 118. What does penicillin treat? Here are the options. Option A, viral infections. Option B, fungal infections. Option C, bacterial infections. Option D, high blood pressure. The correct answer is option C, bacterial infections. Question 119. What is a common side effect of an antibiotic? Here are the options. Option A, bradycardia. Option B, low blood pressure. Option C, improved vision. Option D, yeast infection. The correct answer is option D. Yeast infection. Question 120. What eye condition or disease man said eye medication be used for? Here are the options. Option A. Inflammation after cataract disease/surgery. Option B. Open-angle glaucoma. Option C. Ear infection. Option D. Nasal congestion. The correct answer is option A. Inflammation after cataract disease/surgery. Question 121. How many minutes should you wait between two different eye medications? Here are the options. Option A. 1 minute. Option B. 5 minutes. Option C. 30 seconds. Option D. 30 minutes. The correct answer is option B. 5 minutes. Question 122. Why are benzodiazepines used? Here are the options. Option A. Hypertension. Option B. Bacterial infection. Option C. Anxiety. Option D. High cholesterol. The correct answer is option C. Anxiety. Question 123. What kind of diet should a resident taking in Maui follow? Here are the options. Option A. High potassium diet. Option B. Low fiber diet. Option C. High sodium diet. Option D. Low tyramine diet. The correct answer is option D. Low tyramine diet. Question 124. What do vasodilators do? Here are the options. Option A. Open/dilate blood vessels. Option B. Constrict blood vessels. Option C. Decrease urine output. Option D. Suppress coughing. The correct answer is option A. Open/dilate blood vessels. Question 125. Which is a common vasodilator drug? Here are the options. Option A. Penicillin. Option B. Nitroglycerin. Option C. Metformin. Option D. Synthroid. The correct answer is option B. Nitroglycerin. Question 126. Nitrates are used to dilate which blood vessels and relieve what symptom? Here are the options. Option A. Bronchioles for asthma. Option B. Intestines for constipation. Option C. Coronary arteries for angina/chest pain. Option D. Renal tubules for fluid retention. The correct answer is option C. Coronary arteries for angina/chest pain. Question 127. Which set lists possible side effects of vasodilators? Here are the options. Option A. Increased clotting and weight gain only. Option B. Improved appetite and increased energy only. Option C. Blindness and hearing loss only. Option D. Dizziness, nausea, vomiting, palpitations, flushing, hypotension, and related symptoms. The correct answer is option D. Dizziness, nausea, vomiting, palpitations, flushing, hypotension, and related symptoms. Question 128. Which is a common antiplatelet drug? Here are the options. Option A. Aspirin. Option B. Levothyroxine. Option C. Furosemide. Option D. metformin. The correct answer is option A, aspirin. Question 129. How do antiplatelet drugs such as clopidogrel work? Here are the options. Option A, they increase insulin secretion. Option B, they prevent platelets from aggregating. Option C, they kill bacteria directly. Option D, they neutralize stomach acid. The correct answer is option B. They prevent platelets from aggregating. Question 130. What does digoxin do? Here are the options. Option A, increases blood sugar and causes diuresis. Option B, suppresses cough and loosens mucus. Option C, increases cardiac output and slows the pulse rate. Option D, treats fungal infections. The correct answer is option C, increases cardiac output and slows the pulse rate. Question 131. Which symptoms may indicate digoxin toxicity? Here are the options. Option A, excessive thirst and high fever only. Option B, increased appetite and rapid weight gain only. Option C, improved vision and increased pulse only. Option D, anorexia, nausea, vomiting, visual changes, arrhythmias, or pulse below 60. The correct answer is option D, anorexia, nausea, vomiting, visual changes, arrhythmias, or pulse below 60. Question 132. What does an emetic do? Here are the options. Option A, causes a person to vomit. Option B, prevents vomiting. Option C, lowers blood pressure. Option D, relieves itching. The correct answer is option A, causes a person to vomit. Question 133. Which drug category is used to prevent vomiting? Here are the options. Option A, emetic. Option B, antiemetic. Option C, diuretic. Option D, antihyperglycemic. The correct answer is option B, antiemetic. Question 134. Which set lists common side effects of NSAID? Here are the options. Option A, hair growth, euphoria, and weight loss. Option B, decreased urination and blindness. Option C, nausea, diarrhea, headache, dizziness, and GI upset. Option D, severe hypoglycemia and tremors only. The correct answer is option C, nausea, diarrhea, headache, dizziness, and GI upset. Question 135. Which condition is commonly treated with NSAID? Here are the options. Option A, tuberculosis. Option B, hypothyroidism. Option C, glaucoma. Option D, arthritis. The correct answer is option D, arthritis. Question 136. Which set lists adverse reactions to NSAID? Here are the options. Option A, stomach ulcers, ringing in the ears, renal impairment, and abdominal upset or pain. Option B, improved kidney function and reduced bleeding. Option C, increased bone density and reduced appetite. Option D, cough suppression and bronchodilation. The correct answer is option A, stomach ulcers, ringing in the ears, renal impairment, and abdominal upset or pain. Question 137. To follow the rules of documentation for a drug, you record. Here are the options. Option A. Giving narcotic meds at the end of the shift. Option B. When a drug was not given and why. Option C. Administration of meds while preparing them. Option D. Meds that another CMA gave? The correct answer is option B. When a drug was not given and why. Question 138. Where does gout commonly occur? Here are the options. Option A. Ear canal. Option B. Upper arm. Option C. Big toe. Option D. Scalp. The correct answer is option C. Big toe. Question 139. What is the classification of Coumadin/warfarin? Here are the options. Option A. Antibiotic. Option B. Antihistamine. Option C. Bronchodilator. Option D. Anticoagulant. The correct answer is option D. Anticoagulant. Question 140. Which patient teaching is important for Coumadin/warfarin? Here are the options. Option A. Keep intake of vitamin K foods such as greens, broccoli, and cabbage consistent. Option B. Avoid all fluids while taking it. Option C. Take it only when chest pain occurs. Option D. Double the dose after missed doses. The correct answer is option A. Keep intake of vitamin K foods such as greens, broccoli, and cabbage consistent. Question 141. What is a side effect of liquid iron? Here are the options. Option A. Causes wheezing. Option B. Stains teeth. Option C. Turns urine bright blue. Option D. Causes ear ringing immediately. The correct answer is option B. Stains teeth. Question 142. What is an antilipemic used for? Here are the options. Option A. Treating angina attacks immediately. Option B. Treating fungal infections. Option C. Lowering lipids/cholesterol. Option D. Increasing blood glucose. The correct answer is option C. Lowering lipids/cholesterol. Question 143. What type of diabetes is commonly treated with oral anti-hyperglycemic medications? Here are the options. Option A. Type 1 diabetes only. Option B. Diabetes insipidus. Option C. Gestational diabetes only. Option D. Type 2 diabetes. The correct answer is option D. Type 2 diabetes. Question 144. What condition do proton pump inhibitors treat? Here are the options. Option A. GERD. Option B. Gout. Option C. Asthma. Option D. Parkinson's disease. The correct answer is option A. GERD. Question 145. What type of laxative is Colace? Here are the options. Option A. Stimulant laxative. Option B. Stool softener. Option C. Bulk forming laxative. Option D. Emetic. The correct answer is option B, stool softener. Question 146. What are decongestants used for? Here are the options. Option A, high cholesterol. Option B, low blood sugar. Option C, upper airway congestion. Option D, bone pain. The correct answer is option C, upper airway congestion. Question 147. What type of diuretic is Lasix? Here are the options. Option A, thiazide diuretic. Option B, potassium-sparing diuretic. Option C, osmotic laxative. Option D, loop diuretic. The correct answer is option D, loop diuretic. Question 148. What does an expectorant do? Here are the options. Option A, thins mucus and liquefies phlegm so it can be coughed up. Option B, completely stops all coughs. Option C, prevents urination. Option D, lowers blood glucose. The correct answer is option A, thins mucus and liquefies phlegm so it can be coughed up. Question 149. Lithium is used for which condition? Here are the options. Option A, asthma. Option B, bipolar disorder. Option C, UD. Option D, hypothyroidism. The correct answer is option B, bipolar disorder. Question 150. What patient teaching is important for antiplatelet medications? Here are the options. Option A, avoid all water. Option B, use extra salt. Option C, bleeding precautions. Option D, increase thiamine foods. The correct answer is option C, bleeding precautions. Question 151. What are bronchodilators used for? Here are the options. Option A, closing airways. Option B, lowering cholesterol. Option C, treating gout. Option D, opening airways. The correct answer is option D, opening airways. Question 152. What is an antitussive used for? Here are the options. Option A, nagging dry, non-productive cough. Option B, productive wet cough that should be completely stopped. Option C, high blood sugar. Option D, low thyroid levels. The correct answer is option A, nagging dry, non-productive cough. Question 153. Which items are parts of a valid drug order? Here are the options. Option A, only the drug name and cost. Option B, full name, date of order, drug name, dosage, route, and frequency. Option C, room number and family contact. Option D, diagnosis and insurance number only. The correct answer is option B, full name, date of order, drug name, dosage, route, and frequency. Question 154. What is hemoglobin? Here are the options. Option A, a hormone that lowers blood glucose. Option B, a drug that treats gout. Option C, an iron-containing substance that carries oxygen from the lungs to the tissues. Option D, a kidney structure that filters urine. The correct answer is option C. An iron-containing substance that carries oxygen from the lungs to the tissues. Question 155. What are the 3 safety checks when preparing medication? Here are the options. Option A. Check only after giving the medication. Option B. Check only at the end of the shift. Option C. Check only when the resident asks. Option D. Compare the label before taking from shelf as removing from container and before placing in medication cup. The correct answer is option D. Compare the label before taking from shelf as removing from container and before placing in medication cup. Question 156. What is the correct way to apply nitroglycerin paste/patch? Here are the options. Option A. Wear gloves, remove current patch/paste, clean area, apply ordered dose, initial/date, and do not massage it in. Option B. Apply over the old patch and massage deeply. Option C. Cut the patch and apply to broken skin. Option D. Let the resident apply it without documentation. The correct answer is option A. Wear gloves, remove current patch/paste, clean area, apply ordered dose, initial/date, and do not massage it in. Question 157. What are the 4 basic body processes that affect drug action? Here are the options. Option A. Inhalation, digestion, circulation, and vision. Option B. Absorption, distribution, metabolism, and excretion. Option C. Coughing, sweating, sleeping, and eating. Option D. Tolerance, dependence, allergy, and abuse. The correct answer is option B. Absorption, distribution, metabolism, and excretion. Question 158. Which term describes additional effects on the body that are not part of the goal of drug therapy? Here are the options. Option A. Therapeutic effects. Option B. Indications. Option C. Side effects. Option D. Contraindications. The correct answer is option C. Side effects. Question 159. Which term describes the interaction of 2 drugs that inhibit or cancel each other's effects? Here are the options. Option A. Synergism. Option B. Potentiation. Option C. Tolerance. Option D. Antagonism. The correct answer is option D. Antagonism. Question 160. Which term describes when the combined effect of 2 drugs is greater than the effect of each drug given separately? Here are the options. Option A. Synergism. Option B. Antagonism. Option C. Contraindication. Option D. Excretion. The correct answer is option A. Synergism. Question 161. Which term describes a drug interaction where one drug increases the effect of another? Here are the options. Option A. Antagonism. Option B. Potentiation. Option C. Anaphylaxis. Option D. Micturition. The correct answer is option B. Potentiation. Question 162. The ability of a drug to cross a cell membrane and the rate at which it can do so affects which concept? Here are the options. Option A. Ethics. Option B. Libel. Option C, pharmacokinetics. Option D, slanter. The correct answer is option C, pharmacokinetics. Question 163. How quickly and completely a drug is absorbed into the bloodstream affects which of the following? Here are the options. Option A, resident rights. Option B, room assignment. Option C, meal preference. Option D, drug action. The correct answer is option D, drug action. Question 164. Which is an example of a drug that is given sublingual route? Here are the options. Option A, ibuprofen. Option B, nitroglycerin. Option C, epinephrine. Option D, demerol. The correct answer is option B, nitroglycerin. Question 165. Patients who take sedatives are advised to avoid drinking to avoid the possibility of? Here are the options. Option A, antagonism. Option B, synergism. Option C, potentiation. Option D, toxicity. The correct answer is option C, potentiation. Question 166. The process whereby antacids and iron supplements work against the absorption of the antibiotic tetracycline is described as? Here are the options. Option A, antagonism. Option B, synergism. Option C, potentiation. Option D, idiosyncrasy. The correct answer is option A, antagonism. Question 167. What are the classifications of medication forms? Here are the options. Option A, only tablets and capsules. Option B, only injections and Roman IV. Option C, only creams and ointments. Option D, liquid, semi-liquid, semi-solid, and solid. The correct answer is option D, liquid, semi-liquid, semi-solid, and solid. Question 168. Which term describes drugs that are able to dissolve in water? Here are the options. Option A, soluble. Option B, insoluble. Option C, topical. Option D, parenteral. The correct answer is option A, soluble. Question 169. What preparation should be shaken first? Here are the options. Option A, suspension. Option B, solution. Option C, spirit. Option D, syrup. The correct answer is option A, suspension. Question 170. Which medication form should generally be avoided for alcoholics or diabetics? Here are the options. Option A, tablets. Option B, capsules. Option C, fluid extracts. Option D, ointments. The correct answer is option C, fluid extracts. Question 171. What type of medication can lead to an overdose if crushed, opened, or emptied into food? Here are the options. Option A, plain scored tablets. Option B, immediate release caplets. Option C, liquid suspensions. Option D, spansels/time release capsules. The correct answer is option D. Spansels/time-release capsules. Question 172. Which vitamin category is associated with sources such as sunlight, yellow fruits/vegetables, and green leafy vegetables? Here are the options. Option A. Fat-soluble vitamins. Option B. Water-soluble vitamins only. Option C. Antibiotics. Option D. Electrolytes. The correct answer is option A. Fat-soluble vitamins. Question 173. Deficiency of which vitamin can cause blindness? Here are the options. Option A. Vitamin C. Option B. Vitamin A. Option C. Vitamin K. Option D. Vitamin B12. The correct answer is option B. Vitamin A. Question 174. Which vitamins are not fat-soluble? Here are the options. Option A. Vitamins E and D. Option B. Vitamins E and K. Option C. Vitamins B and C. Option D. Vitamins and K. The correct answer is option C. Vitamins B and C. Question 175. Which term indicates drugs that kill microorganisms directly? Here are the options. Option A. Bacteriostatic. Option B. Antitussive. Option C. Antiemetic. Option D. Bactericidal. The correct answer is option D. Bactericidal. Question 176. Which antibiotic class may be given to someone allergic to penicillin? Here are the options. Option A. Cephalosporins. Option B. Antacids. Option C. Benzodiazepines. Option D. Statins. The correct answer is option A. Cephalosporins. Question 177. What should be avoided because it can interact with cephalosporins and cause abdominal pain, nausea, vomiting, decreased blood pressure, rapid pulse, and sweating? Here are the options. Option A. Water. Option B. Alcohol. Option C. Orange juice. Option D. Fiber. The correct answer is option B. Alcohol. Question 178. Which antibiotic class poses a greater risk of superinfection? Here are the options. Option A. Antacids. Option B. Antiemetics. Option C. Tetracyclines. Option D. Diuretics. The correct answer is option C. Tetracyclines. Question 179. What instruction is important for patients taking sulfonamides such as Bactrim and Septra? Here are the options. Option A. Avoid all fluids. Option B. Take only with grapefruit juice. Option C. Take only at bedtime without water. Option D. Drink at least 3 quarts of fluid per day. The correct answer is option D. Drink at least 3 quarts of fluid per day. Question 180. Warfarin is classified as what? Here are the options. Option A. Anticoagulant. Option B. Antibiotic. Option C. Antifungal. Option D. Antacid. The correct answer is option A, anticoagulant. Question 181. Digoxin should not be given if the pulse is below blank. Here are the options. Option A, 100 beats per minute. Option B, 60 beats per minute. Option C, 80 beats per minute. Option D, 120 beats per minute. The correct answer is option B, 60 beats per minute. Question 182. Which category of medications are cough suppressants? Here are the options. Option A, expectorants. Option B, decongestants. Option C, antitussives. Option D, antacids. The correct answer is option C, antitussives. Question 183. Which category of drugs liquefy or break down mucus so it can be coughed up? Here are the options. Option A, antitussives. Option B, anticoagulants. Option C, antihyperglycemics. Option D, expectorants. The correct answer is option D, expectorants. Question 184. Which category of drugs are vasoconstrictors used for nasal congestion because they shrink engorged mucous membranes? Here are the options. Option A, decongestants. Option B, bronchodilators. Option C, antacids. Option D, laxatives. The correct answer is option A, decongestants. Question 185. Which category of drugs increases the vital capacity of the lungs by dilating the bronchi and relaxing smooth muscle? Here are the options. Option A, antitussives. Option B, bronchodilators. Option C, diuretics. Option D, statins. The correct answer is option B, bronchodilators. Question 186. Which category of drugs neutralize HCl in the stomach? Here are the options. Option A, antibiotics. Option B, anticoagulants. Option C, antacids. Option D, antihistamines. The correct answer is option C, antacids. Question 187. Which drug is an example of an emetic that produces vomiting in cases of poisoning? Here are the options. Option A, loperamide. Option B, warfarin. Option C, metformin. Option D, syrup of ipecac. The correct answer is option D, syrup of ipecac. Question 188. Which drug category suppresses nausea and vomiting? Here are the options. Option A, antiemetics. Option B, emetics. Option C, diuretics. Option D, antihyperuricemics. The correct answer is option A, antiemetics. Question 189. Which category of medication treats intestinal parasites? Here are the options. Option A, antiemetic. Option B, antihelmintic. Option C, antacid. Option D, anticoagulant. The correct answer is option B, antihelmintic. Question 190. Furosemide Lasix is an example of what type of medication? Here are the options. Option A, antibiotic. Option B, antihistamine. Option C, loop diuretic. Option D, antacid. The correct answer is option C, loop diuretic. Question 191. Which is a side effect of combining nitroglycerin and Viagra? Here are the options. Option A, hypertension. Option B, hyperglycemia. Option C, constipation. Option D, hypotension. The correct answer is option D, hypotension. Question 192. What is the most common UTI-related condition for older men? Here are the options. Option A, prostatitis. Option B, otitis media. Option C, gout. Option D, asthma. The correct answer is option A, prostatitis. Question 193. Which condition may be indicated by decreased urinary stream, dribbling, and inability to empty the bladder? Here are the options. Option A, hypothyroidism. Option B, benign prostatic hyperplasia. Option C, osteoporosis. Option D, conjunctivitis. The correct answer is option B, benign prostatic hyperplasia. Question 194. Which drug decreases the symptoms of benign prostatic hypertrophy? Here are the options. Option A, Synthroid. Option B, Lasix. Option C, Flomax. Option D, Bactrim. The correct answer is option C, Flomax. Question 195. Intolerance to cold, personality changes, fatigue, dry skin, brittle nails, slow speech, and weight gain may be symptoms of what? Here are the options. Option A, hyperthyroidism. Option B, diabetes mellitus. Option C, asthma. Option D, hypothyroidism. The correct answer is option D, hypothyroidism. Question 196. What is necessary for adequate production of thyroxine and triiodothyronine? Here are the options. Option A, iodine. Option B, iron. Option C, calcium. Option D, sodium. The correct answer is option A, iodine. Question 197. Where are the adrenal glands located? Here are the options. Option A, inside the lungs. Option B, on top of the kidneys. Option C, behind the eyes. Option D, in the small intestine. The correct answer is option B, on top of the kidneys. Question 198. Large doses of which medication are given to combat allergic reactions and inflammation? Here are the options. Option A, metformin. Option B, warfarin. Option C, epinephrine. Option D, furosemide. The correct answer is option C, epinephrine. Question 199. Which type of tissue attaches muscles to bone? Here are the options. Option A, ligaments. Option B, cartilage. Option C, nerves. Option D, tendons. The correct answer is option D, tendons. Question 200. Which term describes inflammation of the joints caused by excess uric acid in the bloodstream? Here are the options. Option A, gout. Option B, osteoporosis. Option C, hypothyroidism. Option D, prostatitis. The correct answer is option A, gout. Question 201. Osteoporosis is also called what? Here are the options. Option A, acute lung disease. Option B, degenerative bone disease. Option C, viral skin disease. Option D, benign prostate disease. The correct answer is option B, degenerative bone disease. Question 202. What structures are affected by osteoarthritis? Here are the options. Option A, eyes, ears, and nose. Option B, liver, pancreas, and spleen. Option C, spine, hips, and knees. Option D, hair, nails, and teeth only. The correct answer is option C, spine, hips, and knees. Question 203. Methotrexate is used to treat what? Here are the options. Option A, asthma. Option B, GERD. Option C, hypoglycemia. Option D, rheumatoid arthritis. The correct answer is option D, rheumatoid arthritis. Question 204. Which drug category reduces formation of uric acid? Here are the options. Option A, antihyperglycemic. Option B, antitussive. Option C, antiemetic. Option D, anticholinergic. The correct answer is option A, antihyperglycemic. Question 205. Which term describes a wasting away of body tissue? Here are the options. Option A, hypertrophy. Option B, atrophy. Option C, micturition. Option D, anaphylaxis. The correct answer is option B, atrophy. Question 206. Which category of drugs are pain relievers? Here are the options. Option A, antacids. Option B, diuretics. Option C, analgesics. Option D, antibiotics. The correct answer is option C, analgesics. Question 207. Levodopa/carbidopa is used for which condition? Here are the options. Option A, gout. Option B, GERD. Option C, hypertension. Option D, Parkinson's disease. The correct answer is option D, Parkinson's disease. Question 208. Which drug decreases the number of strokes? Here are the options. Option A, aspirin. Option B, Synthroid. Option C, Pepto-Bismol. Option D, Colace. The correct answer is option A, aspirin. Question 209. 1 teaspoon of elixir is equal to Here are the options. Option A, 10 milliliters. Option B, 5 milliliters. Option C, 1 ounce. Option D, 1 cup. The correct answer is option B, 5 milliliters. Question 210. Storing medications correctly and legally is very important. Which of the following actions shows the correct method? Here are the options. Option A, medications with similar names are stored together. Option B, roommates' meds are stored together. Option C, all medications are stored in their own containers. Option D, all opened meds must be kept in the med cart. The correct answer is option C. All medications are stored in their own containers. Question 211. All of the following are oral forms of medications except. Here are the options. Option A, powders. Option B, topicals. Option C, syrups. Option D, enteric-coated. The correct answer is option B, topicals. Question 212. All of the following are topical medications except. Here are the options. Option A, ointments. Option B, creams. Option C, gels. Option D, syrups. The correct answer is option D, syrups. Question 213. Your resident just started a course of metronidazole flagyl and is now complaining of a metallic taste in their mouth. You know that this is what condition? Here are the options. Option A, a common side effect. Option B, a toxic effect. Option C, a medication-caused psychosis. Option D, the person is making this up. The correct answer is option A, a common side effect. Question 214. Medications used for thyroid problems have a common side effect of what? Here are the options. Option A, tachycardia. Option B, bradycardia. Option C, hypotension. Option D, hypertension. The correct answer is option A, tachycardia. Question 215. A common side effect of oral anti-diabetic medications is. Here are the options. Option A, low blood sugar. Option B, diarrhea. Option C, sedative effects. Option D, hypertension. The correct answer is option B, diarrhea. Question 216. What class of medications is commonly used in people with bipolar depressive disorders? Here are the options. Option A, antipsychotic meds. Option B, tricyclic meds. Option C, SREs. Option D, MACE. The correct answer is option D, MACE. Question 217. We classify medications in several ways. Which is one way to classify drugs? Here are the options. Option A, action of drugs. Option B, side effects. Option C, contraindications. Option D, interactions. The correct answer is option A, action of drugs. Question 218. What is the action of an antiviral medication? Here are the options. Option A, prevents the virus from making more virus. Option B, kills the virus. Option C, subdues the virus while the body can kill it. Option D, increases killer T cells to destroy it. The correct answer is option A, prevents the virus from making more virus. Question 219. Diuretics are often ordered first to treat high blood pressure for all the following reasons except which one? Here are the options. Option A, they have fewer side effects. Option B, they work well to help lower blood pressure. Option C, they work quickly to reduce blood pressure. Option D, they help to decrease urination. The correct answer is option D. They help to decrease urination. Question 220. What is a common side effect of antiarrhythmic medications that the CMA should watch for? Here are the options. Option A, increased heart rate. Option B, fatigue. Option C, low heart rate. Option D, high blood pressure. The correct answer is option C, low heart rate. Question 221. A medication is given for relief of anxiety but causes the resident to become more anxious. This is called. Here are the options. Option A, idiosyncratic. Option B, synergistic. Option C, antagonist. Option D, potentiation. The correct answer is option A, idiosyncratic. Question 222. Your resident gets a thyroid medication. You should administer this to them in the morning on an empty stomach, and the resident should. Here are the options. Option A, wait for 3 to 4 hours before eating. Option B, not eat for at least an hour but may have something to drink. Option C, wait for at least 15 minutes before eating. Option D, wait at least 30 minutes before drinking. The correct answer is option D. Wait at least 30 minutes before drinking. Question 223. The reaction to anti-hyperglycemic medication that causes a person to become shaky and feel nervous and confused is. Here are the options. Option A, hyperglycemia. Option B, hypothyroidism. Option C, hypoglycemia. Option D, hypertension. The correct answer is option C, hypoglycemia. Question 224. When a drug's action changes the resident's response in a positive way, the drug is said to provide a. Here are the options. Option A, drug action effect. Option B, dose-dependent effect. Option C, therapeutic effect. Option D, synergistic effect. The correct answer is option C, therapeutic effect. Question 225. As a CMA in Oregon, you have permitted routes and prohibited routes to administer medications. Choose the answer that gives you permitted routes. Here are the options. Option A, subcutaneous route for insulin. Option B, nasogastric tube and G. Option C, transdermal. Option D, ostomy. The correct answer is option C, transdermal. Question 226. As a CMA in Oregon, you have permitted routes and prohibited routes to administer medications. Choose the answer that gives you prohibited routes. Here are the options. Option A, metered dose inhaler MDI. Option B, medication via tubes. Option C, rectal. Option D, nebulizer. The correct answer is option B, medication via tubes. Question 227. Your resident is now on a medication for her depression. Which subclassification is an antidepressant drug? Here are the options. Option A, beta blockers. Option B, tricyclics. Option C, hormones. Option D, antipsychotics. The correct answer is option B, tricyclics. Question 228. What is the action of an analgesic? Here are the options. Option A, destroy microorganisms. Option B, prevent and treat diarrhea. Option C, reduce edema. Option D, reduce and relieve pain. The correct answer is option D, reduce and relieve pain. Question 229. What is the action of an antibiotic? Here are the options. Option A, destroy or inhibit the growth of pathogens. Option B, used to treat and prevent cancer. Option C, destroy or inhibit the spread of viruses. Option D, used to treat a fungal infection. The correct answer is option A, destroy or inhibit the growth of pathogens. Question 230. Tardive dyskinesia should be closely observed for when a person is on what type of CNS medication? Here are the options. Option A, benzodiazepines. Option B, anxiolytics. Option C, antipsychotics. Option D, antidepressants. The correct answer is option C, antipsychotics. Question 231. Your patient is taking warfarin Coumadin. They now have cold symptoms and want to take echinacea for this. You know that the following will happen if they do take this herbal remedy. Here are the options. Option A, it is fine for the resident to take this as it has no effect on Coumadin. Option B, it is not okay because it will stop the Coumadin from working. Option C, it is not okay because the Coumadin makes the echinacea ineffective. Option D, it is not okay because echinacea makes Coumadin more potent. The correct answer is option D. It is not okay because echinacea makes Coumadin more potent. Question 232. Your resident is on digoxin. Labs show it is in range of being therapeutic, but you are not seeing therapeutic effect. You talk with the person and find that they are on which concerning herbal remedy? Here are the options. Option A, echinacea. Option B, ginkgo. Option C, ginseng. Option D, scent, John's wort. The correct answer is option D, scent, John's wort. Question 233. When assisting a resident with an inhaler ordered as 2 puffs, how long should the resident wait between puffs? Here are the options. Option A, 5-10 minutes. Option B, 30-60 seconds. Option C, 15-20 minutes. Option D, 2 hours. The correct answer is option B, 30-60 seconds. Question 234. When assisting a resident with 2 inhaled medications, how long should the resident wait between medications? Here are the options. Option A, 30-60 seconds. Option B, 1 hour. Option C, 5-10 minutes. Option D, 24 hours. The correct answer is option C, 5-10 minutes. Question 235. After giving a bronchodilator followed by a corticosteroid inhaler, what is an important final step? Here are the options. Option A, lie flat for 30 minutes. Option B, avoid fluids for 24 hours. Option C, apply a transdermal patch. Option D, rinse the mouth to prevent thrush. The correct answer is option D, rinse the mouth to prevent thrush. Question 236. After working as a CMA for over 2 years, how many CEU hours are needed to renew certification with the OSPAN? Here are the options. Option A, 8 hours. Option B, 2 hours. Option C, 24 hours. Option D, 40 hours. The correct answer is option A, 8 hours. Question 237. The order reads morphine 10 mg liquid. The bottle reads 2 mg/1 ml. How much should you give? Here are the options. Option A, 2 ml. Option B, 5 ml. Option C, 10 ml. Option D, 20 ml. The correct answer is option B, 5 ml. Question 238. The order says to give liquid Tylenol 1000 mg. The bottle reads 500 mg/1 TSP. How many ml should you give? Here are the options. Option A, 5 ml. Option B, 2.5 ml. Option C, 10 ml. Option D, 30 ml. The correct answer is option C, 10 ml. Question 239. The order reads prednisone 8 mg. You have 5 mg tablets and 1 mg tablets. How many tablets should you give? Here are the options. Option A, 1 5 mg tablet only. Option B, 8 5 mg tablets. Option C, 3 1 mg tablets only. Option D, 1 5 mg tablet and 3 1 mg tablets. The correct answer is option D, 1 5 mg tablet and 3 1 mg tablets. Question 240. What parts does a medication order need to have? Here are the options. Option A, right patient, right medication, right dose, right date/time, right route, and frequency. Option B, only patient room number and drug cost. Option C, only the medication name and pharmacy phone number. Option D, only diagnosis and insurance number. The correct answer is option A, right patient, right medication, right dose, right date/time, right route, and frequency.